I'm Kate Riestenberg, and I'm an applied linguist and social scientist. So my role at Canopy has to do with making sure we're applying the latest language learning science to developing and enhancing our medical specific suite of language learning tools. Many of you who are here with us today probably already have an interest in learning medical Spanish or supporting your students in learning medical Spanish. Or any other language relevant to your patient population. But we think it's worth reiterating just why we think this is so important, because this is actually a question that we do get from time to time. First is, of course, the legal reasons. So guidance from the Department of Health and Human Services requires that any entity receiving federal funding must offer and provide language assistance services at all points of contact in a timely manner during all hours of operation. Of course, this is very difficult in practice. There are so many points of contact with patients, and really not all of these points of contact are good candidates for the use of a medical interpreter. So what can be done to fill in those gaps is one of the other questions that arises. Of course, one way people attempt to fill in these gaps is by using machine translators such as Google Translate. And this is driven, of course, by a need and desire on the part of healthcare professionals to find ways to communicate with their patients, which is certainly admirable. However, according to a 2021 study by researchers from UCLA and Memorial Sloan Kettering Cancer Center, Google Translate really still isn't reliable enough to use for medical instructions. So studies have shown that even for the most commonly used languages such as Spanish, Google Translate can still produce mistranslations with the potential to cause significant harm in 2% of translated sentences. Now, for less common languages such as Swahili, that rate can be as low, the accuracy rate, overall accuracy rate can actually be as low as 10%. So at Canopy, we believe that the best answer to how to fill in these language access gaps is medical language training for healthcare staff, so that as many patients as possible can be treated directly in their preferred language. And this is also because, we know that patient satisfaction is higher, adherence to medications is better, and patients have fewer unanswered questions when treated in their preferred language. And even as clinicians and providers and hospital staff work towards that high level of language proficiency needed to treat patients directly, there are so many opportunities along the way to use the language that you do know just to build rapport with patients. And so that's why a big focus of our professional development tools that John spoke about is on medical language training. So we've been working to develop solutions to this specific aspect of the language access issue. We've talked to hundreds of administrators and healthcare professionals, and we've learned a few things about medical Spanish training along the way. So I'm just going to pass it back to Anna to talk a little bit more about what we've learned, and then I will be back to tell you more about CanopyEDU.
Great, thank you, Kate. So we touched on this briefly earlier, but one way that we have been successfully addressing these issues up to this point has been with Canopy Learn, our online self-paced training platform. So in about 40 hours of total content, we've recreated real-life patient scenarios and everyday clinical encounters to improve proficiency, but we've also placed real emphasis on cultural competence. So we draw on scenarios that you might encounter between various Spanish-speaking communities. Canopy Learn has been a tremendous success, and it's the #1 medical Spanish online training program, and actually is utilized by over 1/3 of the nation's medical schools. And for many programs, this is the solution for them. But we have talked with literally hundreds of key decision makers at these institutions. And what we discovered is that when taking a medical Spanish course to the next step, like integrating it into the program's curriculum with an instructor, administrators are facing the following issues. So first being administrators don't have time to seek out and hire new instructors each semester, especially when there are already very few instructors who are experienced and qualified in teaching medical Spanish. Secondly, administrators also need courses with a proven instructional approach and medical specific content. So for this to happen successfully, the curriculum needs to avoid changing between instructors and semesters, which often happens when adjunct instructors are hired last minute, or if Spanish-speaking faculty leave to go somewhere else. Administrators also need to be able to measure and demonstrate student success and outcomes without creating additional administrative work on the back end. And finally, in offering this successful medical Spanish program, administrators want to see their programs stand out for recruiting purposes, for program recognition, and to assist students in their clinical and career placements. So a solution that addresses all of these factors has really been non-existent up until this point. Now, from our students' perspective, they love the flexibility of online learning, but they want more feedback and more structure. They want to be able to practice speaking with actual humans and breaking off into groups. They also want to be able to track their progress towards their own specific medical goals, because one student's goals might be very different from another, depending on where they're working or where they intend to work. Students want medical Spanish training that offers the accountability, the practice, and the support of in-person language training, but with a flexible program that still works with their incredibly busy schedules. So now I'm going to hand it back to Dr. Riestenberg to dive into more details about how we can address these areas.
Great, thanks, Anna. So we are so excited, based on the research that we've done that Anna just mentioned, to be introducing CanopyEDU. And this is a hybrid e-learning and instructor-led medical Spanish training. So it draws on Canopy Learn, which you've heard about, you may know about already. It's our well-established, widely used online medical Spanish training system. And then it adds the extra boost of a live language course with an experienced medical Spanish instructor. And this results in a flexible and effective sort of best of both worlds approach to medical Spanish training, with enough instructional hours to meet the requirements of a full credit university course. So let me tell you a little bit more about why I'm so excited about this. CanopyEDU is taught by experienced medical Spanish instructors. It prepares students for real-life clinical situations with interactive speaking exercises and real-time feedback. And the really cool part about this is that it takes this modern flipped classroom approach to offer the perfect balance of self-paced flexibility on the one hand and instructor-led accountability on the other hand. So this is an approach that recognizes that traditional lectures really aren't the best use of class time. Instead, there's so much learning that can take place on a student's own time when they have the right tool for it, such as Canopy Learn. And class time should really be reserved for hands-on activities, interaction, feedback, and students' questions. So let's dive in a bit more to see exactly how this works. So each week of CanopyEDU will follow an iterative 3-step process of learn, practice, and grow. So on their own time, in just 1 to 2 hours a week, students can complete lessons and exercises in our Canopy Learn platform. Each lesson combines medical vocabulary, speaking, listening, and cultural competence. And students will also practice listening comprehension and stay engaged by watching our unique telenovela drama, El Puente del Destino. So let's see an example of what a Canopy Learn unit is like. So here we see sample exercises from a unit on talking about pain. On the left side, we have a sample patient-provider dialogue, just a little snippet of it. And students can play these dialogues as many times as they wish. They can also record their own voices and as the provider interacting with the patient and listen back to that. And then on the right side, we see a flashcard that helps students reinforce the key words and phrases from those dialogues. So students can decide whether they want to save a flashcard to keep reviewing, or whether they've got this word or phrase down and don't need to see it anymore. So this is just an example of the tried and true techniques already employed by our popular self-paced Canopy Learn courses. After students complete the relevant units in Canopy Learn, they meet as a group with an experienced medical Spanish instructor to practice what they've learned through speaking exercises, mimicking real-life patient-clinician interactions and highlighting sociocultural factors. So this is the new piece that we've added on for CanopyEDU, and we've actually had a chance to test this out with some students already and get their feedback. So let me show you just a bit more about that. Oops. Sorry, got away from me there. So here we can see Michael, our medical Spanish instructor, and 3 CanopyEDU students participating in a breakout session within the larger live class session. Again, they're talking about pain, putting into practice what they picked up as they went through the Canopy Learn unit on the same topic. So the scenario here is an older female patient to whom we need to ask some questions about her pain. The instructor asks, ¿Qué le preguntamos? What can we ask her? And the students are able to draw on the phrases they've learned, try speaking them out loud, get a response and feedback from the instructor, and listen to the questions that their peers ask as well, and feed off of each other in that interaction. So we've done some learning, we've done some practicing, and the last crucial piece here is grow. This is what I think makes Canopy really special. As we've mentioned, students receive support from an experienced medical Spanish instructor, including office hours, feedback, and guidance. And students are going to know exactly how much they've learned and where to focus next, because their progress is tracked systematically using Canopy's Can-Do framework. This is the only medical language proficiency framework of its kind. So what we did is, drawing on well-established methods in language learning science and dozens of interviews with healthcare professionals, we developed the only language proficiency framework that's specific to the medical context. And this includes our inventory of essential speaking and listening skills, as well as the Canopy scale for bilingual proficiency, the only freely available medical proficiency scale with detailed descriptions of each proficiency level that are medical specific. And then, to allow learners to track their progress on an even more granular level, we also developed a set of can-do statements that allows anyone to assess their progress on each skill by tracking what you can already do in the language and what to work on next to move up the scale. So our students who we saw talking about pain just before in the live class, many of them were at this basic level that we see at the bottom here. They're asking and answering familiar questions for concrete needs related to patient interactions. And there are others in the class who are more at this emergent level, so getting more comfortable with both routine and non-routine situations and giving brief explanations. So CanopyEDU is designed around these types of can-do statements in a way that meets students wherever they currently are on the scale and helps them push up towards the next goal. And this framework is also what's going to allow administrators to be able to measure growth over time and report out about accountability in their medical Spanish training. So this is just a small glimpse, but you can check out more about our approach to medical language proficiency by downloading our free toolkit at withcanopy.com/canopy-toolkit. So you see that link there. And what's been really fun for me recently is that we've been able to get some feedback about this approach from students who've tried it out with us and then did some surveys and focus groups to give us their feedback. And what we found is that after completing 2 Canopy Learn self-paced lessons and then 1 75-minute live class with us, 8 out of 10 participants felt more confident in Canopy speaking skill number 1. That's asking and answering familiar questions to be able to meet a range of concrete needs related to patient habits, lifestyle, living situation, symptoms, and history. And 8 out of 10 students also said the course would help them better understand and build rapport with Spanish-speaking patients. Alexandra, a third-year medical student, said, I understand Spanish, but I don't really feel comfortable speaking it with patients for time purposes, that it would make the interaction take longer. She said, I think it's really helpful to be kind of forced into that situation where you have to speak Spanish. And then Liana, a fourth-year medical student, said, I like the videos and there was some new terminology for me. Then the in-person component of mock patient situations is really helpful. So we're really excited about this new offering, and we're confident that students are going to be just as satisfied with CanopyEDU as they already are with our self-paced Canopy Learn courses. So with that, I'll pass it back to Anna to tell you more about how you can partner with us to be among the first to take advantage of CanopyEDU.
Perfect. Thank you again, Kate. So with all of this in mind, like Kate said, we are actively looking for institutional partners who want to break ground with us on CanopyEDU. And the great thing about this is because the adaptation of the product is brand new, our early adopters will have a huge say in how the program is actually rolled out. Not to mention, because your input is so valuable, we'll be able to offer flexible packages for you and your institution as a thank you. We want to learn from you and be able to give back to you in a way that truly enhances your program. So to this point, and thanks in part to our funding and recognition from the NIH for innovation in healthcare, we do have many Canopy champions within the community, and we already serve a variety of educational and clinical-based institutions. So you can see here a few of these institutions such as UCLA, Stanford, Texas Tech, Northwestern, New Mexico, NYU, and many more. And again, there is good reason why Canopy Learn alone, the foundational point of CanopyEDU, is the #1 medical Spanish training program and is used by over 1/3 of medical schools. These programs have seen a lot of success, and here are just a couple examples of the administrators seeing benefits. So Dr. Bernard Lopez from Thomas Jefferson University said Canopy Medical Spanish program has been central to the success of our medical Spanish curriculum in the medical school. And then Priscilla Lee, a nurse practitioner from UCLA, said Canopy Medical Spanish is one of the best courses I have ever taken. Better even than a university course I took in person because it truly is medical Spanish. So what we're looking for is really thought leaders who are looking to enhance their program and address this massive language barrier between healthcare professionals and their patients. So as I previously mentioned, we want to learn from you. What's been central to Canopy's success so far has been listening to what you all have to say and then adapting the product to specifically meet the needs of your program. So with that all being said, if you are interested in becoming a partner, we would love to hear from you. And you can see our website linked here in the first link. You can also email us at the address there and set up a time to lock in your placement or discuss any specific questions that you might have. We'll also be sharing some follow-up information with you after the webinar, and the webinar has been recorded as well. But thank you all again for joining us today. We are really excited about the launch of CanopyEDU, and we hope to speak with you and hear from you soon. And again, happy National Hispanic Heritage Month.